Good morning, everyone. So, today we are starting with the major condition in the children and which is more common nowadays, that is CP, cerebral palsy. Now, what is cerebral palsy? So, the definition is it is a group of permanent disorders attributed to non progressive damage કે એકવાર આ ડિઝીઝ થઈ ગયું then it is not progressive. It is a non-progressive type of disease which cause damage to infant or fetal brain and that affect the development of posture and movement which cause activity limitation. So the definition is it is a group of permanent non-progressive disorder which damage the infant's or fetal brain and affect the developmental posture and movements. So this is about the definition of cerebral palsy. History हम देखें. So in history the cerebral palsy was first described by the English physician Sir Francis William Little in 1861 and was known as Little's disease for a long time. એટલે કે ફર્સ્ટ કોણે ડિસ્ક્રાઇબ કરેલું સર વિલિયમ લિટલે in 1861 so that's why sometimes it is also known as Little's disease. Little throughout that this condition was caused by neonatal asphyxia, so that's why it is known as the Little disorder. Epidemiology. So CP is the most common cause of childhood disability in western societies. So the incidence is 2 to 2.5 per thousand live births. अगर 1000 चिल्ड्रंस है बर्थ हुआ है तो इन दैट 2 या 3 चाइल्ड में CP प्रेजेंट हसे. So that is epidemiology. Etiology is the etiology can be identified only in 50% of the cases. Otherwise, it is basically idiopathic also. So certain factors in the history of the child may be the cause of risk of CP. Now we see the time of brain injury. So first is prenatal period, okay, then perinatal period and postnatal period. First is prenatal period. So it is conception to the onset of labor. કન્સેપ્શન થયું ત્યારથી ઓનસેટ ઓફ લેબર સુધીનો જે ટાઈમ છે દેટ ઇઝ પ્રીનેટલ પીરિયડ. Perinatal period means 28 weeks intrauterine to 7 days postnatal. એટલે કે 28 વીક થયા જે જેસ્ટેશનના ત્યારથી લઈને 7 days postnatal. So 28 weeks intrauterine to 7 days postnatal, that known as perinatal period. Now risk factors આપણે જોઈએ અથવા causes કહો કે risk factors કહો. These are responsible for cerebral palsy. First is prenatal causes or risk factors. તો prematurity એટલે કે if the mother age is less or the gestational age less than 36 weeks, these are under cause of prematurity. Second is low birth weight એટલે કે less than 2500 gram, okay, less than 2500 gram if the baby weight, that is low birth weight. Maternal epilepsy, then torch infection during pregnancy, that is toxoplasma, then rubella, okay, chlamydia, herpes virus. So this infection can lead to the chances of cerebral palsy. Then bleeding in the third trimester, this is about the risk factors. Then incompetent cervix proper dilatation nahi thase, severe toxemia and eclampsia, hyperthyroidism in mother, drug abuse એટલે કે મધર વિધાઉટ પ્રિસ્ક્રિપ્શન ઘણીવાર પ્રેગ્નન્સીમાં ડ્રગનું ઇન્ટેક કરે that also cause the chances of cerebral palsy. Trauma, multiple pregnancies, twins, triplets, okay, and placental insufficiency, okay, so that also cause the cerebral palsy. Perinatal that is prolonged and difficult labor, premature rupture of membrane during pregnancy, presentation anomalies એટલે કે જો નોર્મલી સર્વિક્સ એટલે કે બેબીનું જે હેડ હોય એ ડિલિવરી ટાઈમ પર cervix પર engage થવું જોઈએ, but if it is a bridge position, buttock is on their side, so the presentation anomalies also lead to the delivery delay and that cause the cerebral palsy, vaginal bleeding at the time of admission for labor, bradycardia to the mother or the fetus, and hypoxia, less oxygen reaches to the brain and that cause the damage of the brain tissue for the permanent level, so that cause the cerebral palsy. Next is postnatal, 0 to 2 years after delivery. So CNS infection, that is encephalitis or meningitis, hypoxia, less oxygen, seizures, neonatal hyperbilirubinemia, which is more common cause, and head trauma that lead to the chances of cerebral palsy. So these are the postnatal risk factors. See in this chart here, the low birth weight is the most common cause, that is 35 to 40% chances. Then metabolic errors 5%, infection 5 to 10% chances, congenital brain abnormality 5 to 10%, intrapartum asphyxia 9%, intrauterine ischemic event 5 to 10%, genetic or chromosomal condition agar hase genetic, so that is 2 to 5%, and other factors chances are 22.5%. Now the pathological findings in the CNS. So specific brain lesion related to cerebral palsy can be identified in most of the cases. These lesions occur in the region that are particularly sensitive to disturbance in blood supply and are grouped under the term of hypoxic ischemic encephalopathy. ઓકે, તો અગર પર્ટિક્યુલર રિજનમાં બ્લડ સપ્લાય પ્રોપર નહીં થશે અને એ શું કરશે, ઇસ્ચેમિયા પ્રોડ્યુસ કરશે ગ્રુપમાં, દેટ ઇઝ hypoxic ischemic encephalopathy. So total 5 types of hypoxic ischemic encephalopathy exist, that is lesion location and clinical findings. So first is parasagittal cerebral injury. If lesion is on this side, location bilateral in superior medial and posterior portion of cortex. તો શું ચાઇલ્ડમાં જોવા મળશે, upper extremity more affected than lower extremity. Okay, in this condition, if the lesion in periventricular leukomalacia, so location bilateral white matter necrosis near lateral ventricle, descending fibers of the motor cortex. So the clinical findings is spastic diplegia and quadriplegia, visual and cognitive deficit present in the children. ઓકે, એટલે કે મેમરી પ્રોબ્લેમ હશે, કોગ્નિશનમાં પ્રોબ્લેમ હશે અને વિઝન્સમાં પ્રોબ્લેમ હશે. If the focal and multifocal ischemic brain necrosis, so the location is infarction in a specific vascular distribution. તો એનાથી હેમિપ્લેજિયા અને સીઝર્સ આવશે because vascular problem is present. And last is status marmeritus, that is neuronal injury in the basal ganglia, so that lead to chorioathetosis or mixed type of cerebral palsy. Now the clinical findings. Children with cerebral palsy present with 3 types of motor problems. First is primary impairment is muscle tone, balance, strength. Tone is affect, balance is affect, and strength, and selectively are directly related to damage in the CNS. These are the major impairments. Secondary impairments of the muscle contractures and deformity develop over time in response to primary problems, and musculoskeletal growth is affected. તો અગર ચાઇલ્ડમાં આ સિમ્ટમ્સ જોવા મળે છે, primarily impairments, so you have to consult a physician and diagnose this child by the CP. Now tertiary impairments, that are coping responses that the child develops to adapt to the primary and secondary problems. Now the primary impairments that in chart, muscle tone is affect either spasticity or dystonia, balance is affect, strength is affect, selectivity and sensation problem. Secondary impairments, contractures, that is equinus or adduction deformity and deformity like scoliosis. Tertiary impairments, adaptive mechanism, એટલે કે અડપ્ટિવ મિકેનિઝમને કારણે ટર્સરી ઇમ્પેરમેન્ટ્સ થશે ડ્યુ ટુ સેકન્ડરી, દેટ ઇઝ ની હાઇપર એક્સટેન્શન ઇન સ્ટાન્સ પોઝિશન, or we can say genu recurvatum it is. So that is tertiary impairments. કોમન સાઇટ્સ ફોર કોન્ટ્રાક્ચર, કે કઈ કઈ સાઇટ્સ પર કોમન કોન્ટ્રાક્ચર થઈ શકે છે ઇન ધ સીપી ચાઇલ્ડ. સો ઇન અપર એક્સ્ટ્રીમિટી પ્રોનેટાર, elbow, wrist and finger flexor and thumb adductor. So these sites which common undergoes into the contracture position. Then lower extremity, hip adductor and flexor, knee flexor and ankle plantar flexors. Common sites for deformity. So spine, in that whether the scoliosis or either kyphosis is present, femur and tibia, internal or external torsion, hip subluxation and dislocation, and foot equinus valgus and varus. Now cerebral palsy is likely if there is no head control 3 months. આપણે ક્યારે સજેસ્ટ કરી શકીએ કે CP હોઈ શકે with clinically. So if the head control is not come under 3 months, child cannot sit up to 6 months, roll over 6 months is not till yet, and walking 18 months થઈ ગયા, then child cannot walk. So we can diagnose clinically that yes, there may be some deformity or disorder like cerebral palsy. Signs suggestive of cerebral palsy, that is abnormal behavior of the child, excessive irritability or crying, poor eye contact. Okay, child eye contact નહીં કરશે socially. Then poor sleep, oromotor problems, salivation dropping થશે, then એના teethમાં problem હશે. Okay, frequent vomiting and poor sucking. That are the signs of suggestive cerebral palsy. Other is tongue retraction, persistent bite, grimacing, facial expression બનાવશે child. Okay, then poor mobility, poor head control, hand preference before 2 years of age, and abnormal tone, whether it is dystonia or spasticity, that are also signs of CP. Major deficits in cerebral palsy, that is loss of selective motor control and dependence on primitive reflexes patterns for movement. એટલે કે ચાઇલ્ડની અમુક એજ થઈ ગઈ ટાઈમ પછી પણ પ્રિમિટિવ રિફ્લેક્સ રહેશે, એ લોસ નહીં થશે અને ચાઇલ્ડ એના પર ડિપેન્ડન્ટ રહેશે. ઓકે, અને સિલેક્ટિવ મોટર કંટ્રોલ લોસ થઈ જશે. દેટ ઇઝ મેજર ડેફિસિટ્સ ઇન CP. Then abnormal muscle tone, that is strongly influenced by body posture, position and the movement. Imbalance between agonist and antagonist muscle, that lead to fixed muscle contracture and bony deformity, impair body balance mechanism, sensory loss, that is vision, hearing problem, and superficial and deep sensation of the child is also affected. Associated problems, seizures, mental retardation, that is cognition affects us, behavioral problems, nutritional problems due to poor feeding and etc., and constipation, which is major deficit in CP. Now the classification of the cerebral palsy. So basically 4 classification is present based on severity level, topographic distribution, motor function and gross motor function. We discuss one by one. First is based on the severity level. Okay, in that mild, moderate and severe is present. Second is based on topographic distribution, that is monoplegia or monoparesis, diplegia or diparesis, hemiplegia or hemiparesis, paraplegia or paraparesis, triplegia or triparesis, double hemiplegia or double hemiparesis, tetraplegia or tetraparesis, quadriplegia or quadriparesis. Third is based on motor function, BMF, so pyramidal or spastic CP, extrapyramidal or non-spastic CP. In that 2 classification, that is ataxic and dyskinetic, and last type is mixed CP. Fourth classification based on gross motor function system, which is very helpful, that is GMFS. 5 levels, it helps to determine surgeon to treatment, therapy and assistive technology. So in that total 5 level 1, 2, 3, 4 and 5. So these are the basic classification of the cerebral palsy. Now we discuss one by one in next part 2. Thank you.